HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health, because when we raise health, we raise everyone. The new Brian Halpin Pediatric Cancer Center in Staten Island, New York, will be life-changing for families and children battling cancer. Thanks to the help of celebrities and philanthropists, this state-of-the-art center has come to life. Give it a listen.
So tell me, other than the fact that it's a little bit bigger, how is it different, the new center?
I think it's not only bigger, but the patients are going to have a little more privacy. So each of the infusion bays is going to be a place where the patient has a little more room to themselves. They often have at least one family member with them, so there'll be a comfortable place for the families to sit. They're not in and out visits. Many times they spend a couple of hours with us. So providing them with a space where they can feel comfortable during that visit is really important, and I think will be life-changing for a lot of these patients.
I did want to talk about a couple of donors, and specifically I wanted to talk about Tracy. So Tracy Morgan, I've been a fan for a long time, but now he's very near and dear to my heart. It's very rare to hear that a celebrity is donating all of their time to help raise money for peds cancer care and is just so passionate about children.
I think he's incredible. And we know that laughter is one of the best medicines. It's not the cure to cancer, but it helps with all the treatments that we give. So I think the time and energy and the passion that he has to help our patients is an absolutely amazing thing to watch. Watching him with one of our little patients was quite a sight to see. They got together and it was like they were lifelong friends.
And do you remember what happened that day when he came? And we filmed a HealthWish with Tracy, and if you all haven't seen it, you should, because it's actually really, really good, and it really meant a lot to me to do it, and it was really, really wonderful. But we set aside time so that Tracy could meet one of the patients that was most affected by this. And I can tell you, I didn't pick the kid, but whoever did, my gosh. Can you pick a more charming kid?
Yep.
But we kept having to delay the day because Tracy spent so much time with this little boy, because they were having so much fun together, and he hit it off with the mom and the dad, and you couldn't see that if you were filming it, but we could see it. I mean, it was borderline tearjerker. It was amazing. So it was kind of cool to see, from my standpoint, all that actually happened. More to follow. You'll be hearing a lot more about Brian Halpin, whose name is on the center. It's really just an amazing individual, and we're really proud to actually bear the name in the Peds Cancer Center. I know you feel just as strongly about it. So I did want to ask you and kind of talk about what this building actually looks like and what that actually means to what you do. We're in the lobby here. On this floor is radiation oncology, which luckily I don't think a lot of kids get radiation oncology, which I think is overall a good thing. On the second floor is a fully functioning doctor's office. We'll be using that mostly for adult oncology patients, but really, frankly, it's really no different than if you were actually in a doctor's office. And then on the third floor, it's kind of split, where you have your full service infusion center on the adult side, and then you have a completely separate area that's full service for peds. It includes infusion areas, it includes where you'd see your patients, and it gives you the ability to do everything all in one place. Can you tell me what that actually implications of that are for you?
So our patients are able to get access to all the different services that they need all in one location, which is nice. They don't have to jump to different buildings to see the social worker or to get their infusion or to get their blood drawn. Everything is all in the same proximity, which is very helpful for the patients. There's a waiting room that's just for pediatrics. There's a new consultation room. There's an increase in the infusion bays, which are private. There's a child life or playroom as well. So we really are incorporating every aspect into one area so that the families and the children can feel most at home in that one area.
Dr. Pierro, tell me the one thing you're most excited about.
I think exactly what Dr. Romanos just said. We're finally in one space, and I'm actually really excited for our kids to have their own waiting room, their own place to check in, because now we're mixed in with the adult oncology patients, which I think takes away a little bit from the attention from the children. And I think this is a space that's solely for them, where they're going to feel at home, feel that it's their place, where they could be themselves, they can be children.
It's a nice size space. Yeah, I think that the families will be happy with that, because the reality is when you are going through this, you are going to spend a little bit of time here.
Yeah, and they sometimes come with other children. So if they don't have childcare, there's a sibling or two in tow. So I think it's very important for the families to have that space.
And I think the one benefit of having those delays in construction that we experienced was that we were able to really learn from our patients. over the last couple of years to really learn what their needs are, what they wanted. We've seen growth in our patient numbers as well, and we were able to accommodate everything that's needed and everything on the wish list in our new center. So I'm really excited about that.
So that's interesting that you brought that up. People definitely stayed closer to home during COVID. And I think what it did is it actually exposed more parents to being taken care of in their own community. And I think one of the things that I'm most proud of as the person responsible for these campuses is that those trends haven't returned. Like your increases in volume that we got probably starting with COVID didn't go away. So as we've seen a lot of these folks return to their regular routines, yours haven't, because I think you've demonstrated to them that there is a benefit to being taken care of in your community, and you are going to get the same health care, and you are going to see the same providers. I mean, for God's sake, you both train there, you've both worked there, you know the deal. It's not really any different, right? And I think that there's real power to that.
And I think it's really nice sometimes to be as small as we are, because we may be small, but we are mighty in what we can do. Everyone in our group knows the patients by name, knows the parents, knows the siblings. We really make it a place where people can feel at home, feel like they're taken care of by family. You're not seen by a different provider each time. You're always seen by your oncologist. We do step in for one another, but for the most part, we see our own patients, and our nurse practitioners are wonderful in caring for the patients. It really is a place where everyone is taken care of as a whole, themselves, their family, their needs, their wants. Everything's taken into account.
So I have to ask you about one of the coolest traditions. Tell me about your holiday party.
Well, it started very small a few years ago, over a decade ago, where we would just gather everybody together. It was a nice way for the patients and the families to spend time with each other and celebrate each other without being in the midst of treatment. And it's kind of grown through the years. We have very, very fancy parties. We have gifts donated by other donors. And we are so excited each year to be able to celebrate each patient's siblings, everybody's family, and to get together and enjoy the time together outside of the infusion suite, outside of the doctor's office. So it's a tradition that everybody looks forward to. We get asked about it, early November, people ask, what's the date of the party, because we need to set it aside. And the staff really enjoys it too. It's not just for the patients. We enjoy being able to sit with and play with and enjoy the company of our patients outside of the medical visit. So it does as much for us as it does for them.
Yeah, I have to tell you, of all the things that I've gotten to do in this job, this is definitely up there with one of the most heartwarming things that you can actually do. Just seeing the children and their siblings and, getting gifts. And frankly, for some of these children, it's the only gift that they're going to be able to afford. So to be able to share that joy and that love with everyone, regardless of where they came from, regardless of their socioeconomic status, it's kind of it's a very fun thing to see. And it's one of the most heartwarming things that I've been a part of in this job. So thank you so much. This is really fun. I mean, you never want to see a child with cancer, but I look forward to actually seeing you all take care of people up there. I'm really excited about it. Thank you so much for doing this.
Thank you.
Yeah.
Pleasure.
And I want to thank you, Staten Island, for being a part of this. HealthWish is something that is really an opportunity for us to share all the amazing things that are happening, not just in our hospital, but also in our community. I hope you're as proud of it as we are.
HealthWish wishes to thank our special guests, Dr. Romanos and Dr. Pierro, Staten Island's own pediatric oncologists. For more information on the Brian Halpin Pediatric Cancer Center and ways to give back, please click on the link in the video description. We're very interested in your HealthWish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.